Somewhere tonight, a woman is awake at 3 in the morning. Her heart is pounding and she does not know why. She has not slept properly in a year. She forgets words in the middle of sentences. She snapped at her children again today, and she does not recognize the person doing it. So she did the responsible thing. She went to her doctor. She gave the blood, she waited, and she was told 4 words. She will go home, she will not get better. And nobody in that room will have done anything wrong. Her physician followed the guidelines exactly. The laboratory reported accurately. The system worked as designed. And that is the problem. A reference range does not measure your health. It measures how closely you resemble a statistical average. And that average is built from the people who show up at laboratories. People who are by definition already unwell. Being unremarkable inside that crowd is not the same as being well. For most of his working life, Dr. Richard Nkwenti stood on the other side of a pharmacy counter, handing people a small white bag. He is a registered pharmacist. He holds a Master of Science in Health Sciences in Integrative Medicine from George Washington University and a PhD in Integrative Medicine. He is a fellow in anti-aging, metabolic, and functional medicine, a hormone restoration specialist, and the founder of the compounding pharmacy, Pharmaprodia. He did not collect those qualifications for a wall. He collected them because the same patients kept coming back for the same prescriptions. And every month, they were a little worse than the month before. In his own words, counting pills accurately is not the same as helping someone. I had spent years being precise about the wrong question. Since founding Pharmaprodia, he has personally formulated more than 50,000 doses of compounded bioidentical hormones. 50,000 is not a business statistic. It is 50,000 mornings. A cream applied before work. A capsule at bedtime. A woman sleeping through the night for the first time in 3 years. He has also personally analyzed more than 35,000 sets of hormone and thyroid laboratory data. Working alongside physicians, translating numbers into medicine built for one person. And nearly every one of those patients had been told at least once by someone they trusted while they were falling apart. The modern alchemist is his argument with that word. A pharmaceutical tablet is made for 1 million people. A compounded dose is made for 1. The difference is not sentiment. It is arithmetic. Commercial hormones arrive in fixed strengths, chosen because they are easy to manufacture, easy to market, easy for a prescriber to remember, not because a human body asked for a round number. In a compounding laboratory, the dose is weighed to the milligram against one patient's body weight, absorption rate, and receptor sensitivity. The particle size is milled small enough to cross skin. The base is chosen for where the molecule needs to go. 2 women of the same age, the same weight, the same diagnosis, can need doses that differ by a factor of 4. The standard model has one answer for both of them. The book is built on cases. 3 of them recur. A 44-year-old woman told she was too young for menopause. Her day 21 progesterone was under 5 nanograms per milliliter, a number no one had thought to measure. A collapse of the hormone that calms the brain and holds the uterine lining. A 52-year-old man, testosterone of 380, told he was fine, but his binding globulin was high, and almost none of that testosterone was free to reach a cell. He was not depressed, he was deficient. A 38-year-old woman whose ovaries were removed on a Tuesday, handed a low-dose patch and sent home to a body that had lost its estrogen, its progesterone, and half its testosterone in the space of an hour. In each case, the laboratory report was unremarkable. In each case, the patient was not. This book was written for the patient in that waiting room. But it was also written for the people trying to help her inside a 7-minute appointment. For the primary care physician, who was trained to rule out disease and was never given a framework for dysfunction, and who has a flagging system that only speaks up when a value falls outside the brackets. For the nurse, who is usually the first person to hear what is actually happening and who has watched a patient be reassured out of the room. For the nurse practitioner, who increasingly writes these prescriptions, and who needs to know why the route matters as much as the molecule. Why transdermal estrogen protects the heart, and why oral progesterone rebuilds sleep. for the OBGYN, carrying 20 years of fallout from a single 2002 study. A study that tested conjugated equine estrogen and a synthetic progestin and told a generation of women almost nothing about the hormones their own bodies make. And for the endocrinologist, who will find here a pharmacist's argument made in the language of receptors, binding globulins, first-pass metabolism, and the difference between a total and a free hormone. Not an attack on the specialty, an invitation to it. There are the panels to order, the questions to ask, what compounding can do that a fixed dose cannot, and the honest limits when the standard of care is exactly right and when it is not enough. If you are bleeding, you want the guidelines, and you want them fast. This is a book about the other patient, the one who is deteriorating slowly, in range, and unheard. What this is really about is not hormones. It is the years between the day someone stops feeling like themselves and the day anybody takes it seriously. For most people, that gap is measured in years, sometimes decades. In that gap, careers stall, marriages thin out, bones quietly lose density that will not be rebuilt. A brain goes without a hormone it uses to protect itself. None of it appears on a chart because none of it was ever flagged. This book exists to close that gap. The Modern Alchemist. 234 pages, 8 chapters. The Science of Your Hormones, The Art of the Compounded Dose, and the Case Against a Word that has been used to dismiss far too many people. If you have been told you are fine, and you know that you are not, this book is the explanation you were not given. If you are the clinician on the other side of that desk, it is the framework nobody taught you. Click the Buy Now button. Paperback, hardcover, and Kindle. You are not a bell curve. You are not a reference range. Stop settling for normal. 6 lines were designed as on-screen graphics, not narration, so they aren't in the text above. If your narrator should speak them instead, drop them in where the gaps fall. Your labs are normal. It is not a diagnosis that they were normal. The dose is the difference between a poison and a cure. Paracelsus. It does not ask clinicians to abandon medicine. It asks them to stop accepting an average as an answer. Click Buy Now. Start reading tonight. The first one matters most. And she was told 4 words: that they were normal.